No matter where you look in Victoria's health system, there appears to be a crisis unfolding. And at the heart of the problem is a workforce shortage. There just aren't enough qualified staff, and the ones we do have are burning out. Jiva Sanjivan worked as an emergency paediatrician for 15 years.
You always feel that you are not spending enough time with the family, and also they are missing me as well. You feel really down when you think about that.
He now runs a candle-making venture after deciding something had to give. He left the medical profession in 2019, just before the pandemic began to place even more strain on the health system. His wife Suji left her clinical research role for the same reasons. They believe more health workers will leave if there's not systemic change.
There's a lot of medical graduates in Australia, but they fall through the cracks and they move on to something else.
Around 14,000 people left the Victorian health workforce in 2020 during the depths of the pandemic. Immigration has dried up and universities aren't training as many staff as needed. And now Victoria is in a race against other states and the rest of the world to attract workers here.
So without the workforce, you've really got nothing in health. So building it up and getting it ready for the future and recovering from the pressures of the last years is absolutely critical.
It's estimated Victoria needs an extra 65,000 healthcare workers by 2025 to keep up with demand. But there's only so much catching up we can do.
The gap's only going to get bigger, and so we need to start thinking, how can we do things better as well?
Part of the solution is better utilising the healthcare workers we already have. I've come to the Mildura region to check out a new program that's doing just that.
You're right on the hill.
Yep.
Yeah. So the heart specialist was happy.
Should be thick as okay.
Ebony is a paramedic, but she's not chasing emergencies anymore. In a Victorian first, she's been employed as a community paramedic to connect with vulnerable people and get ahead of emergencies before they happen.
We're offering health assessments and we're offering blood pressure checks. We talk about their risk of developing cardiovascular disease, their risk of developing diabetes. So we're trying to look at the person as a whole.
Unlike other health professions, there's actually 6,500 more paramedics in Australia than there are positions with ambulance services. So as well as using an underutilised resource, this gives them an alternative career path.
I sort of was looking for that change. I'm now a mum and I've got 3 kids.
I love your hat, John. It's got Bugs Bunny.
Expanding into a different role will allow much greater career longevity for me.
You go into a doctor, you tell them what's wrong, they go, hand you a prescription, bye. I come here to the paramedic and she sits down, she talks to me, she asks me questions that no one's ever bothered to ask.
Do you mind having a seat?
Paddy Pullman came in to have her blood pressure checked, but then the words started spilling out.
There's always that depression,
absolutely
anxious.
She's now been connected with a counsellor as well as a lung specialist.
I just found that I could have a chat about how I feel, and out of it, yeah, well, we can help you with that. So doors have opened everywhere for me. Yeah, so it's just been wonderful.
When you get to our age, you don't express your problems, you don't say anything about them. You want to talk to somebody, but you don't know where to go. And the paramedic is a perfect person. She understands. But you put me into a program that might save me life.
Sean.
Thank you.
Health has been at the centrepiece of this election so far, with both sides of politics promising billions of dollars to improve the ailing system. So let's take a look at what the major parties are offering. Pledges for new hospitals have dominated the early part of the campaign. Labor's promised to build or upgrade 10 hospitals across the state so far, with a price tag of $6 billion. The Coalition's pledged more than $5 billion for 17 new or upgraded hospitals. Most are in regional Victoria. But staffing the hospitals is a major issue. Labor's promised to train 22,000 nurses, including covering the cost of 10,000 nursing degrees. The Coalition says it will train 40,000 nurses and pay for 25,000 degrees, including 5,000 scholarships in the private sector. Labor's also pledged to upskill 25 paramedics to treat patients in the field, 25 new urgent care clinics to ease pressure on emergency departments, and pour $35 million into children's cancer research. While the Coalition has promised to halve the elective surgery waitlist by working with the private sector, boost the state's mental health workforce, including 1,300 new psychologists over 2 years, and provide free public transport for healthcare workers to encourage more staff to stay in the job.